Hey guys, I'm here in the office of my outpatient clinic. I'm just reviewing some charts, and I have a patient coming in that I'm going to be teaching her some information about heart healthy lifestyle changes. And so basically, the patient case is a 58-year-old woman with high blood pressure, high cholesterol. She has a BMI of 33. She has type 2 diabetes, and she's a smoker. She's coming to my outpatient clinic complaining of back pain. She lives in a one-story home with 3 steps to get into her house, and she lives with her 23-year-old daughter, who is her primary caretaker and housekeeper. Basically, she presents with decreased range of motion in lumbar flexion and side flexion, as well as increased pain in her low back. She has trouble bending over to tie her shoes in the morning, and also has trouble bending over to put her dog leash on. She does enjoy walking her dog, which is good, and she also enjoys going to the casino, which she hasn't been able to do because of her restrictions. She has some significant family history. Her mother died from a heart attack recently. She has no significant cultural boundaries. She's just a Caucasian who speaks English, and she is presents as motivated and ready to learn. She's a Gen X, and she's expressed her motivation to lose weight and to start a diet and exercise plan. She is aware of her risk factors, and she wants to be able to fix her lifestyle and change it in order to decrease these risk factors of having a heart attack before it's too late. She cares about her daughter very much, and she also feels bad that she puts a large burden on her daughter, who is still young and has to donate a lot of her time to her. Her learning style is that she's a problem solver. She's a Gen X generation. Her level of expertise is beginner. And so basically, in her need assessment, this patient needs to know about how at risk she is for a potential heart attack. And so I'm going to take my knowledge on the topic and really try to help her make a lifestyle change. I'm going to assess my patient's needs by asking her questions about her mother's heart attack and her risk factors and see if she's able to point any of them out to me. I'm also going to assess what motivates her. Right now, I'm assuming that it's her daughter and her motivation to be able to be less of a burden for her daughter. In order to assess her progress, I'm going to ask her to correctly identify lifestyle changes at the end of our session that she's going to be beginning. Starting with a walking program is what I'm going to prescribe to her today. I'm also going to ask her to explain her risk factors to me and the importance of her lifestyle change. I think that her stage of change is that she's in the preparation stage because she is motivated and she is preparing to make some huge lifestyle changes in order to better herself. So basically, her objectives are that she will be able to correctly identify warning signs of a heart attack, and then by the end of the session, and then also she will be able to correctly identify at least one of preventative measure that should be implemented into her lifestyle, which for today it will be a walking program. So let's go get her. Hi Connie, my name is Claire Lakin and I'm a physical therapy student at the University of Scranton. Today we're just going to be talking about some heart healthy options and some lifestyle changes. Is that okay?
Yeah, that would be great. I know we have heart disease in both sides of my family. My grandparents both died of a stroke. My mom passed away around 6 months ago with a heart attack, and my father has high blood pressure. I also have a brother whose blood pressure is starting to get high as well. So I'm really anxious about my heart health and what I can do to make sure I stay healthy.
Perfect. Well, I'm glad to see that you are aware of the risk and the path that you are traveling down. There are a few risk factors for having a heart attack. I have this printout that I have for you so that you can refer to it. Basically, it tells you about the risk factors being age, high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of exercise, stress, family history, and metabolic syndrome. You already pointed out some of those, but could you run through them, some of the ones that you think that you may have?
Sure. I know I should be out exercising more. I am not real concerned about my diet, and I probably should be. I do see my doctor once a year, but maybe I should have my blood pressure checked more than that with my family history. And I do smoke, and there's a lot of stress in my family.
Well, Connie, some that I'm aware that you have are your high blood pressure, you have high cholesterol, your cigarette smoking, your high body weight, and your family history, being your mom. I just want you to be able to remember these risk factors and understand the importance in doing so. Then, because if we can work on them, we can decrease your risk factors. We will decrease your chance of having a heart attack. That is why I want you to keep that handout for the remainder. But good news for you is that you are young and you still have a lot of life to live. It is important that we take the right steps to decrease these risk factors, to decrease your chances of having a heart attack. It seems that you have already expressed the need to do so as well.
Yes, I am ready.
So what are some things that motivate you?
My biggest motivation right now is my daughter. God bless her.
Just keep going.
She is 24, and she spends all of her time taking care of me. She cooks and cleans for me. And does all the housework for me. She takes me to all my appointments. I know it's tough on her as she is in an online school, and she gives me way too much of her time. I want to be able to be there for her and to be at her wedding and meet my grandchildren, which I won't be able to do if I continue to live the way I'm living now.
That is a great motivator. And it is good to have one because this journey is not going to be easy. I think what's best for you is to start small. You seem very motivated to start a new diet and exercise plan. Today we are going to be going over an exercise program. Exercise is good for helping you to lose weight, but it's also good for helping to decrease your blood pressure, decrease your stress that you talked about, and help your heart get stronger. I have printed out a calendar with daily walking goals for you that you can refer to.
Thank you.
Some of the things that we are going to be focusing on are time, frequency, and intensity. We are going to start slow and build up slowly in order not to damage your heart. We're also going to have to monitor that back pain that you've been experiencing. The calendar shows when and how long you will be doing each walk. It might be a good idea to bring your dog along because you express that you like walking your dog, or even ask your daughter to join to increase your motivation.
That's a great idea. I'm looking forward to starting my new walk calendar.
So the T here stands for time. That is the amount of time that you'll walk. We're going to start you at 20 minutes. The F is for frequency, and that stands for how many times a week you will be walking. We are going to start with 3 times a week. And lastly, the I is for intensity. That's basically just how fast you're going to be walking. We're just going to be using your normal walking pace to start. You might want to make sure that your daughter is there a few times just in case you start experiencing any symptoms of a heart attack. And when you do, the first thing you're going to want to do is call 911.
Okay, isn't there an app for my phone?
Oh yeah, I can show you the app. Basically, we're going to want to open up your phone, and we're going to use the stopwatch app, and that's going to help you time your walks. So this is the stopwatch app. You just click on that, and then you go, there's some options down at the bottom. You make sure you're on stopwatch, and you just hit start. And this app will count up you reach 20, and that's how you'll know when to stop.
Thank you.
Are you aware of any of the signs and symptoms of a heart attack?
You know what? I'm really not.
Well, you're in luck. I have this handout here with the various symptoms. Common heart attack symptoms and signs include pressure, tightness, or squeezing sensation in your chest. It can spread down your arm into your neck and jaw. Patients can also experience nausea, indigestion, and shortness of breath, fatigue, or lightheadedness. Specifically in females, they can have upper back pressure. So for you, it's important to be able to recognize the difference between your back pain and a pain that's associated with a heart attack.
Thank you so much. This has been very informative, and I'm very excited about trying to make a change.
Great. Now I just want to run through it one more time just to make sure that you understand everything that we went over. So do you remember any of the potential risk factors that you have for a heart attack?
I think you mentioned high blood pressure, high cholesterol. I really probably need to stop smoking. My diet needs to change. Losing weight would be a good thing for me. And I do have a pretty significant family history that I probably should be aware of.
Great. So based on what we talked about today, what's one thing that we're going to do to change that?
Well, I'm really excited to start my walking program. And I'm going to focus on time, frequency, and intensity. For me, I will start slowly, about 20 minutes a day, 3 times a day, at my normal walking pace. And I have my calendar, thank you very much, to follow if I get confused. If I get tired, it's okay to take breaks. And if I experience any chest tightness in my chest or upper back, shortness of breath, fatigue, I will call 911.
Perfect, Connie. I'm so excited to go onto this journey with you, and one day at a time, we're going to make a healthier heart. So, do you have any questions about anything we talked about?
Yeah, I'm concerned about sneakers because a lot of times when I do a lot of walking, I had pain in my back.
All right, so basically, some sneakers that I would recommend are maybe Asics or Brooks. They're good walking sneakers. But the number one indicator for a walking sneaker is comfort. So when you go to the store, you want to make sure you try them on and see what feels best and what's the most comfortable for you.
Thank you. I am definitely going to do that.
Okay, perfect. So we're done here today. I'm going to check in your next appointment, but good luck with the start of your walking program, and I hope everything goes well.
Thank you so much. Okay, and we did pretty